Hello and welcome. Today, we're diving into a rare and complex neurological disorder known as Bateman syndrome. While not widely discussed, understanding its intricacies is crucial for those affected and the medical professionals who support them. We'll explore its causes, symptoms, diagnosis, and management, shedding light on this often overlooked condition. The precise etiology of Bateman syndrome, also sometimes referred to as familial adult myoclonic epilepsy or FAME, remains largely unknown. However, it's strongly believed to be a genetic disorder. Research suggests that mutations in specific genes are responsible for its development. These genes play vital roles in neuronal function, and when they are altered, they can lead to the characteristic symptoms of the syndrome. The pattern of inheritance often points towards autosomal dominant transmission, meaning that if one parent carries the mutated gene, there's a 50% chance their child will inherit it and potentially develop the condition. However, spontaneous mutations can also occur, meaning a person can develop Bateman syndrome even without a family history. At the core of Bateman syndrome lies a dysfunction within the central nervous system. The genetic mutations disrupt the normal electrical activity of the brain, specifically affecting the motor cortex, the region responsible for controlling voluntary movements. This disruption leads to hyperexcitability of neurons, resulting in involuntary muscle jerks, or myoclonus. The cerebellum, which coordinates movement and balance, may also be affected, contributing to tremors and difficulties with coordination. The specific mechanisms by which these genetic mutations translate into neurological dysfunction are still under investigation, but research is actively exploring the molecular pathways involved. Bateman syndrome is considered a rare disorder. Accurate prevalence and incidence data are limited due to its often subtle presentation and potential for misdiagnosis with other neurological conditions. It's found across various populations worldwide, with no apparent predilection for specific ethnic groups. The age of onset typically occurs in adulthood, usually between the second and fourth decades of life, although some cases can present earlier or later. Because it's so rare, accurately gauging its impact on the population is an ongoing challenge. The hallmark symptom of Bateman syndrome is myoclonus, characterized by brief, involuntary muscle jerks. These jerks can range from subtle twitches to more forceful movements that can disrupt daily activities. The myoclonus often affects the upper limbs, particularly the hands and arms, but can also involve other parts of the body. Tremors, especially intention tremors that worsen with purposeful movement, are another common feature. Many individuals with Bateman syndrome also experience epileptic seizures, which can vary in type and severity. Other symptoms may include mild ataxia or problems with coordination, and in some cases, psychiatric symptoms such as anxiety or depression can occur as well. Diagnosing Bateman syndrome can be challenging due to its rarity and overlapping symptoms with other neurological disorders. The diagnostic process typically involves a thorough neurological examination, including assessment of motor function, reflexes, and coordination. An electroencephalogram or EEG is crucial to detect abnormal brain activity associated with seizures and myoclonus. Genetic testing can confirm the presence of specific gene mutations known to be associated with the syndrome. Magnetic resonance imaging, or MRI, of the brain may be performed to rule out other structural abnormalities. A detailed family history is also essential to assess the likelihood of a genetic component. While Bateman syndrome is primarily considered a single entity, some researchers suggest that the severity and specific features can vary between individuals. This variability may be influenced by the specific genetic mutation involved, as well as other genetic and environmental factors. No universally recognized subtypes exist, but clinicians often categorize cases based on the predominant symptoms, such as those with more prominent myoclonus versus those with more frequent seizures. Further research is needed to fully understand the spectrum of presentations and whether distinct subtypes can be identified. Currently, there is no cure for Bateman syndrome, and treatment focuses on managing symptoms and improving quality of life. Medications are often prescribed to reduce the frequency and severity of myoclonus and seizures. These may include anticonvulsants such as valproic acid, levetiracetam, or clonazepam. Tremors can be managed with medications such as primidone or propranolol. Physical therapy can help improve coordination and balance. Occupational therapy can assist with adapting daily activities to minimize the impact of symptoms. Psychiatric symptoms, if present, may be treated with antidepressants or anti-anxiety medications. Regular follow-up with a neurologist is crucial to monitor the condition and adjust treatment as needed. Since Bateman syndrome is primarily a genetic disorder, there are currently no known methods to prevent its development. For families with a known history of the condition, genetic counseling is recommended. This can help individuals understand the risks of inheriting the mutated gene and make informed decisions about family planning. Prenatal testing may also be available to determine if a fetus carries the gene mutation, although this raises complex ethical considerations. The prognosis for individuals with Bateman syndrome varies. While the condition is typically not life-threatening, the symptoms can significantly impact daily life and overall well-being. The severity of symptoms can fluctuate over time, and some individuals may experience periods of remission. Recent research is focused on identifying new genetic mutations associated with the syndrome and understanding the underlying mechanisms of neuronal dysfunction. Clinical trials are exploring the potential of novel therapies, including gene therapy approaches, to target the root cause of the disorder. Although progress is being made, further research is crucial to develop more effective treatments and ultimately find a cure for Bateman syndrome. Thank you for joining us in this exploration. Understanding rare diseases like Bateman syndrome is essential for advancing medical knowledge and improving the lives of those affected.